caregiver supports. I just want to let everyone know that we are recording today's webinar, and you will receive a link to the archived webinar in the next few days so that you can listen again at your leisure or share with colleagues who maybe were not able to join us today. My name is Jill Kagan, and I'm the Program Director of the ARCH National Respite Network and Resource Center. With funding from the Administration for Community Living, ARCH houses the Lifespan Respite Technical Assistance Center. Through this initiative and through the ARCH Resource Center, we do provide training and technical assistance to Lifespan Respite grantees, their partners, to national, state, and community-based organizations, all with the goal of improving the quality of and access to respite for all family caregivers across the lifespan. Also through the ARCH National Respite Locator, we also assist family caregivers to find respite services and funding resources. To familiarize you, if you're not familiar with the workings of Adobe Connect, which is the webinar system we're using today, I'm now going to turn it over to our fantastic webinar facilitator, Emily Turner, and she will give us a tour of the webinar screen.
Yes, thank you, Jill. Good afternoon, everyone. I'm just going to go over quickly a few ways that you can participate on today's webinar. Just a note, due to the large number of participants today, most everyone will be on mute and listening through their computer speakers. We will be monitoring questions through the chat box, and we'll be answering them at designated Q&A times throughout the presentation. To use the chat box, simply type in your question and hit send. You may do this at any time during the presentation. You don't have to wait to submit your question once the presenters are finished, so feel free to type it in at any time. If you find your screen is too small, click the full screen button above the purple arrow. To return back to normal viewing, you can click that button again. You can also download today's slides in the materials section. Simply click that file name and then select download file. It's in PDF form. And as a final reminder, this webinar is being recorded and will be available for viewing once it's been archived. We will notify you by email when it's available. And that's it, Jill, so I'm going to turn it back over to you.
Thank you, Emily. As always, very helpful. Many of our Lifespan Respite grantees and partners who are working to develop their statewide coordinated systems of respite services to help family caregivers access respite. They're focused on developing new partnerships for collaboration as well as long-term sustainability plans to make sure that they can continue the very important work they've already accomplished. Given the very high percentages of family caregivers who are in the workforce, engaging employers as partners in these efforts makes good business sense for them. And the workplace does provide an excellent venue for us and for the grantees to reach family caregivers with education, information, and support. Developing this approach to engaging employers in respite and caregiving supports requires knowledge about the experiences of working caregivers, as well as some communication savvy to deliver the most effective message. That's why I'm so interested to hear our speakers today, because they're going to be providing insight into both of these by providing national data on working family caregivers and employer responses, and some of these data are hot off the press, as well as the experiences of an innovative partnership in New York City that's working to bring their talents and resources directly to the corporate workplace to benefit caregivers. We have two really wonderful presenters today who will address all of these aspects of employer engagement from a national as well as a local perspective. Before I introduce our speakers, I thought it would be really helpful to them, as well as to those of you who are listening today, to find out whether or not you, as our webinar participants, are already working locally with employers on respite and caregiving issues, and if so, in what ways. So we have two very quick polling questions for you that are popping up on your screen. The first one is, have you engaged employers in respite or family caregiving issues? And you can respond to that yes or no just by clicking on yes or no with your mouse. And we'll give you all a few minutes to respond to that question and then see the results.
I'll leave it open a couple more seconds. Okay. All right, Jill.
Well, that's quite a few of you are actually engaged. Almost a third of you who are out there are doing something with your employers. Now we'd like to know how you are engaged. Can you, in terms of what services or supports are these employers actually providing based on your involvement? And you can check all that apply.
Okay. All right, there you are, Jill.
Great. Thank you all for responding. As you can see, it looks like among those of you who are engaging employers around family caregiver and respite supports, most of you are doing so through employee education or information or referral to respite and other caregiver supports. So that's very helpful as we move forward to learn about what employers are doing nationally and what we can do locally to improve the service delivery across those options. Just a reminder, again, we will pause after each speaker for questions and comments, and you can enter your questions via the chat box as Emily described. We'll do our best to respond to as many of those questions as possible. If we don't get to your questions today, please be assured that we'll get back to you via email, or you will also have the contact information of our presenters. And please, please don't forget to take just a moment to respond to the quick survey link that will pop up when you close out of the webinar today. That would be extremely appreciated. We really value your input. Now to introduce our fantastic speakers. Our first speaker is Dr. Ken Matos, who is the Senior Director of Research at the Families and Work Institute in New York City. He also serves as a member of the senior leadership team there. He conducts research on a wide range of workforce and workplace issues, including diversity, mentoring, work-life fit, and workplace effectiveness. His responsibilities include identifying emerging employment issues and trends, conducting analyses, and reporting on the findings from the Families and Work Institute's ongoing nationally representative studies, the National Study of Employers, and the National Study of the Changing Workforce. He also co-directs When Work Works, a project on workplace flexibility and effectiveness in collaboration with the Society for Human Resource Management. Our second speaker, next slide, Emily, is Gregory Johnson. He's also an ordained interfaith minister, but he serves as the director of the community outreach at EmblemHealth and creator of EmblemHealth's Care for the Family Caregiver program. While at EmblemHealth, Greg founded the New York City Family Caregiver Coalition and the New York City Partnership for Family Caregiving Corps. He's also a fellow at the New York Academy of Medicine. He recently released an 8-part video series, which I commend to you. I've watched it, and it's really fantastic, called You Are Not Alone. And in addition to serving as a requested retreat leader, spiritual director, and guest lecturer, Greg also serves as a volunteer chaplain with the New York Police Department's Gay Officers Action League. On a personal note, and very important to Greg, is that he has been and is a family caregiver. His partner of 41 years passed away a few years ago, and their son preceded them in the death of 2005. So he is really speaking from a great place of compassion and commitment around family caregiver issues. So thank you both so much for agreeing to present on this webinar today. We're really so delighted to have you, and I will turn the presentation over to our first speaker. Ken, please go ahead.
Thank you very much. Thank you, everyone, for having me today. As Jill mentioned, I'm Ken Matos. I'm the Senior Director of Research at the Families and Work Institute. And today I'm going to be walking you through some of our recent research around caregiving in the U.S., both from an employer and from an employee perspective. So just quickly a little bit about us. We are a nonprofit, nonpartisan research institute focused on issues around integrating different parts of people's work, personal, and family lives in more successful and meaningful ways. We do a lot of work around workplace flexibility and ways in which people can pursue all of their goals simultaneously. You can see a lot of our research at the link at familiesandwork.org. So we do a number of research studies, but the two that we're going to reference today are our National Study of Employers. Our National Study of Employers, which is a survey of over 1,000. I'm sorry, I'm getting a lot of feedback on the line.
Yep, I just fixed it, Ken. Sorry about that.
No problem. So a survey of over 1,000 employers from around the U.S., all of which have 50 or more employees, and we asked them a lot of questions about their various practices and programs around supporting employees and helping them be more successful both on and off the job. We also use that to provide information for our When Work Works Award, which actually recognizes specific organizations that have met our standards for workplace flexibility and employee support. If you go to our website at whenworkworks.org, you'll be able to see that list, and if they're in a company in your area, they might be one that you want to reach out to around these issues. 2014 Older Adult Caregiver Study was sponsored by Abbott Nutrition Products to help us go and talk to your average worker and unemployed person around their perspectives about caregiving. So we were able to ask both people who were employed and unemployed and who were currently caregiving and not caregiving what they thought about the kinds of supports you would need for care, what they expected for their own lives in the future in terms of how much care they'd have to offer, and what kind of things they thought would really make that work caregiving role successful. And so those are the two data sources that I'm going to be presenting today. And so let's begin with the National Study of Employers data, talking about trends in the U.S. So one of the first things that we found with that study was that flexibility is both rising and falling at the same time. So for workplace flexibility that is focused on how and when you work within the course of a day, so being able to adjust your schedule, take breaks when you want, some degree of telework have all been on the rise since 2008. You can see from the bars on the top half of the chart. On the other hand, the bars on the lower half of the chart show how fewer employers are engaging in policies that allow employees to take extended periods of time away from full-time work. So fewer employers are saying they allow employees to share jobs, to work part-year, or to take a career break for personal and family responsibilities. So what this means from an elder care and respite perspective is that it's easier to talk to employers about how people work on a day-to-day basis, and they're more engaged with those kinds of adjustments. But if you're talking about time away from work entirely, there seems to be a less fertile ground for those conversations. So, and thinking about respite in particular, you'll probably want to be very clear about what you mean by respite. Are they getting time away from their caregiving responsibilities, or are they getting time away from care and work and a variety of things? You may find that employers are more engaged with things that help their employees manage caregiving so that they can put more time into work, and less engaged with things that say the employee is going to effectively, from their perspective, take a vacation from all the things in their lives. We also looked at the lengths of caregiving leaves that organizations are offering. In the U.S., employers with 50 or more employees who meet a couple of other requirements are required to offer at least 12 weeks for the various forms of leave that are listed on this slide: maternity, paternity leave, adoption or foster care leave, and care of seriously ill family members, which is most relevant to elder care and respite issues. However, we saw in our most recent study that 21% of employers with 50 or more employees who said that they were supposed to follow FMLA guidelines indicated that they didn't for at least one form of family support that covered by FMLA. That was primarily around issues of spouse-partner leave, but we do see that the amount of time that's been offered to people engaging in care of seriously ill family members has also declined. It had been a little over 13 weeks in 2008, and now the maximum average is down to 12 weeks. So there does seem to be a little less generosity and more anchoring around that bare minimum that's required by FMLA. Elder care assistance. We see a lot of employers are saying that they offer employees time off to provide elder care without jeopardizing their jobs, about 75%, and that number hasn't changed. One thing that might be important as you talk to employers about that sort of finding is exactly how they do that, and are they providing meaningful time off. What's important to know about the stress literature is that stress from any source can be damaging. So if you get out of one stressful situation to walk into another stressful situation, that's not actually giving you time to rejuvenate. So when talking to employers and helping them understand that the time that they give isn't absolute in its value and that they may have to think about how that time gets structured, that's another sort of anchor for why and how Respite can help their employees recover their strength so that they can continue to succeed at work and at home. We also see a greater investment in the provision of elder care resource and referral information, which seems good since a number of you in the poll mentioned that you were making use of relationships with employers by providing information. So that seems to be an area of growing investment. We tend to see employers more interested in things that don't really cost them very much or that have large advantage in terms of economies of scale. So providing information tends to be cheap and able to be applied to a large number of employees quickly and easily. Similarly, dependent care assistance programs have that same advantage of being sort of a mass application. When we look at access to respite care, and we see about 3% in 2008 and 7% in 2014. That change wasn't statistically significant, so it's probably always been more around 5 and hasn't really changed over the years. So what growth opportunities are there is some of what we're here to talk about today. So to help you sort of plot out what kind of employers might be most invested in the idea of providing respite, I have some of the data around the companies that said that they did provide respite services on our national study. And in just a second, I will tell you our definition. So we asked employers what they offered in terms of respite services. And our specific question around respite was, do they provide access to respite care for employees with elder care responsibilities? Respite care refers to short-term care that helps families take a break from their normal routine of caring for elderly family members. So we gave them a definition of the concept just to make sure that they understood what we were asking. And we had about 7% of our total sample, or 75 employers, saying that they offered those kinds of respite services. In general, we saw that smaller employers were more likely to be in that pool of people who offered respite services. And similarly, we saw that employers with fewer work sites also tended to be the ones that provided the most, were most likely to provide respite services. While this might sound surprising at first, we have found in several iterations of this survey that small employers tend to be a little more innovative in terms of workplace flexibility, whether that's because they have more personal relationships with their employees, and so a tale of a person's unique experience is more convincing than it might be in a large company where it ends up being a little bit more abstract. Or they have a much more greater investment in the retention of specific individuals throughout the organization because it's smaller, and therefore people have a lot more of the organizational history tied up in their experiences, as well as a greater sense of what would we do without you, that may help make them a little more willing to experiment with workplace flexibility. Finally, there's also just the reality of not having as much bureaucracy that allows you to try something new and experiment in a way that a larger organization may not. Note that what we also found was that about 75% of the employers in this group indicated that their HR policies were determined at HQ when they had more than one work site. Only about 23% said that the local work sites and the headquarters had mutual influence. So if you can get access to a local branch and then use them to get a presentation at headquarters, you probably will get a little bit further than if you simply talk to a local branch that doesn't have the authority to do any sort of changes in policy or application of money. If what you're providing is mostly just information as opposed to something that the organization has to officially sponsor, then you may find a little more traction when you're working at a local work site. In terms of the industries that are most invested in respite activities, 58% of the employers who had respite services were nonprofits, so slight majority. We also saw that the respite services were most common in organizations that identified as being either professional services or other services. Other services is a really kind of catch-all category used by the U.S. Bureau of Labor Statistics, and that's anything from like a hair salon to a repair service, generally all of the things that happen on a much more local, personal level, as opposed to the very large-scale industries that tend to be in the professional services, trade, or manufacturing and goods-producing industries that we have below. And we also took a look at whether or not they tended to have part-time or full-time employees. Interestingly, a large number of the employers that had respite services had large part-time employee pools. So 44% of the respite employers had more than 75% of their employees being part-time. That could mean a number of different things. One possibility is that because their employees are part-time, it's easy to just say, okay, you're just not going to get any shifts for a period of time, and you can go do what you need to do and then come back. That's something to also think about and address when you're talking to employers. Sometimes they can forget the sort of economic security issues that are engaged when employees take time away from work, even if it's sort of necessary time for them to recharge and return. So keeping them in mind and thinking about how will their employees survive during that time is also an important detail. We also looked at the relationship between employers who have Respite and offer the other types of care that I mentioned earlier. Almost all of them said that they offer time off without jeopardizing jobs, which is good. But again, make sure that when you talk to them, it's not just about jeopardizing jobs, but also jeopardizing, can they pay their rent? Elder care, resource, and referral is very commonly associated with Respite. In all likelihood, it's probably a first gateway activity into providing Respite services. And then dependent care assistance programs seem to be a little bit less common, but that aligns with the issue of more smaller organizations providing Respite, since dependent care assistance programs reap their greatest benefits for the program managers when there's lots of employees enrolled. So there may just be less enrollment in DCAPs for these smaller organizations that are engaging in Respite services. So our next piece of information will come from our study of older caregivers, looking at, or caregivers of older adults is a better way of framing it, looking at their thoughts about how you make the two things go together. One of the really interesting findings that we had in the study was that Respite is not just a woman's problem, but women probably have more problems with it. So when you look at these charts, the key things to pull away is that when we look at the overall population of caregivers and non-caregivers, we see that 65% of all the women in our study said that they had provided care in the last 5 years, but only 56% of the men said that they had provided care. So on the one hand, it is a larger experience for women on the whole, but when we look at working caregivers, the difference pretty much evaporates, if not flips, where we have 51% of working caregivers were men and 49% of working caregivers were women. So from an employer perspective, there is no gender difference, even if from a societal perspective, there is one. And in the note on the lower left-hand corner, we found one thing that was somewhat disheartening, was that fewer employed women than employed men indicated that they were able to take as much time away from work as they needed without worrying about losing their jobs. So while respite and time off is an issue for everyone, women may just have more difficulty having that conversation, or it may be that women are more likely to be in part-time jobs, and that part-time jobs just tend to be a little less stable with less supports for their employees, so that there's a little more anxiety around being able to keep their jobs. We also found that elder care goes beyond parents. Almost half the caregivers cared for a parent in the past 5 years, 49%. We found that 13% said they were caring for a community member, someone they weren't related to, which is a surprisingly large number for people being invested in the care of people outside their families. And so that may be a good anchoring point to talk to employers as well, to sort of say, this is also giving your organization some great branding and recognition in the community that your employees are helping other people in the community, and in exchange, you are helping them in return. And so a branding perspective is something we find often pushes employers to do things that may not seem in their best interests at the start, but over time work out to serve them, the community, and their employees well. Another angle for talking to your employer contacts is the reality that caregiving employees have a second unpaid part-time job. Overall, we found that caregivers reported a median of 16 hours per week providing hands-on care, so that's housework, meal preparation, physical care, transportation, things where they have to be present and interacting directly with the person they're caring for. and they spend about 6 hours per week performing other responsibilities such as arranging services or assisting with finances, more of the external facing activities. Some examples of the kinds of things, 86% said they were doing grocery shopping, 77% said they had medical care responsibilities for their elder, 74% said they were preparing meals. So it is definitely a time-consuming experience, and helping them understand it from a work framework of this is effectively a whole other job that they're doing without pay may help them think about it in terms of employee sustainability and workplace issues, which they may be more familiar with. We also find that the medical tasks that people are working with are complex and varied. 77% of caregivers responded that the elder had 2 or more chronic health conditions or was hospitalized within the past year. The chart shows our top 10 chronic health conditions that people reported. One other thing to sort of play up with these kinds of experiences is that people are having to learn effectively another job. They are stepping up and learning how to care for somebody with a variety of different issues, many of whom had never done any sort of medical reading before. And it's a mark of their ability to grow, to learn, to adapt that they're able to do this. And these are the kinds of employees that you want at your organization, where when things are not going perfectly, they're able to say, I can figure out how to get this done well, and with real passion. And that's something that really makes elder caregivers stand out. And Respite is an opportunity for them to practice and hone those skills away from the day-to-day action of providing care to perhaps read, process, and understand what they're doing in a new framework. So presenting Respite as a way to practice some essential skills is another marketing opportunity for employers. Finally, few employees reach out to their employers, according to our data. When we asked who would you turn to for information about how to provide elder care, employee assistance programs, HR departments, coworkers, and supervisors came in very, very low. They were much more likely to talk to a medical professional or family or friends. But the reality is, while you may know what medical services to provide, how you're going to find the time to do it is a conversation that requires your employer. And so flagging for employers that these are problems waiting to happen because communication isn't occurring, and that they need to take a step forward and create these kinds of conversations and opportunities by showing their support for caregiving through things like Respite services, will enhance the likelihood of being able to be proactive and ensure that their employees are prepped and ready to manage all the things that are going on. We also asked about employees' sense of the value of Respite services. We found that clearly over a third of caregivers and non-caregivers alike viewed access to Respite services as being very important. In many cases, caregivers saw things as more important than non-caregivers. Respite services, however, had very little difference. So clearly, if people are aware of it and they understand it, they think it's something that should be important. And to that point, if people are valuing a service, that's another way for them to position themselves in the market as a good employer. And being able to do that helps them get better talent. Now is a really great time to put that out there. Many people are now in the sandwich generation looking for some kind of employer that'll make it possible for them to be and do all the things they need to do with family. And so it's an active part of the job choice and intent to stay decisions. And so employers that can brand themselves as good spots will be in a better position to catch the people they want. We also found that the fears that caregivers had the most around taking time away from work was around income and wages. As I mentioned earlier, employers are offering job secure time away from work, but it's the ability to make sure that you can still pay your rent, still afford to actually buy medicine and food and other supplies that seems to be weighing on employees' minds. It's not enough to give them time, but employers that are really going to sort of take the forward point in this new era of elder care are going to be the ones who think about both job security and economic security. We also asked the respondents to our survey to talk about what they thought was the one thing employers could do to make their elder care responsibilities more compatible with work. And there's a variety of items listed on this slide, and I'm not going to go through all of them, but a lot of it really focuses on giving them permission to deal with the issue, either by being transparent and providing like clear guidelines on how to request and use time without playing games with them, to just acknowledging that elder care and child care are both important things in people's lives, and they both need to be planned for and dealt with. And so employers that can create that kind of open space, again, possibly by providing information, providing respite services, and other things that activate people's recognition that they are thinking ahead and opening the door to a conversation about elder care, are going to find that people are able to plan and execute their work better because they're no longer trying to create an awkward and hidden balance between work and home and caregiving. So at this point, I'm going to open the floor to any questions you may have. The 5 links on this page are to our various resources on elder care as well as employers. So the first one is our study of employers. The second is our study of older adult caregivers. As you see, as I've discussed in this survey, there's a lot more data in both of those studies that might be useful to you. We have a nice infographic that you might want to be able to hand out to an employer in one of your conversations to help them understand what caregivers are facing. We have an older study on everyday realities and wishes for change. That's from our 2008 national study of the changing workforce. It's another employee study, but it's much bigger in scope than the older adult caregiver study, and so that may provide you some additional information or talking points. We'll be renewing some of that data over the course of the next year as our next data set comes in. And finally, we also worked with Abbott to create a toolkit for employers around elder care, specifically on the importance of therapeutic nutrition and how that can help improve employees' the care recipients' outcomes, and thereby keep employees from being distracted by having to go through the hospitalization cycle where someone comes out of the hospital, they don't get sufficient nutrition, they end up back in the hospital, and the employee is continuously pulled away from work as a result. So these are all resources that you should feel free to use. They're all free and available for download at the links on these slides. At this point, if anyone has any questions, you can put them in the chat and I'll answer them, or we can move on.
Thank you, Ken. I think that this is Jill. That was exceedingly informative, and I learned a lot that I didn't know, especially the surprise about small employers and those providing part-time more likely to provide some respite support. So that was an interesting piece to me. And I do want to also thank you for taking the time to pull specific respite information from both of those studies so that we could have this exceptional information. So thank you. And we do have one question that's come in. Emily Kearns would like to know if you have examples of successful respite outreach programs in the workplace.
So I don't have any such examples currently available. We do maintain a When Work Works program. So what that does is we gather a lot of information from employers and we recognize them, but we also continue to stay in touch with them. So one thing we could potentially do is check with that network and see if any of them have had any experiences with Respite services and how they came to understand and value those services. And so that might be a useful way to sort of get more info on how you make a successful pitch.
Thank you. Any other questions? I have one question that is sort of a follow-up to that last one, Ken. You did mention that you gave, in the National Employer Study, you offered the definition of respite as a temporary break from caregiving. But what is your understanding of exactly what it was the employers were thinking of when they said they were providing respite? Was it the actual time off that was temporary as opposed to, a more extended family type leave? Or was it financial assistance with respite services, or more through the information and referral to respite services piece? Were you able to get that from your information, or was it just really a yes or no response?
Unfortunately, it was a yes or no question. The way it's written, from the way they answer other questions, my expectation is that they are focused on time as opposed to other activities. One thing that might also be helpful as we move forward is if there's a more nuanced definition, we could potentially include that in our future studies and gather that kind of information. But at this point, I would say that given the way we described it to them, they're probably focused on time issues rather than other issues they could do to help with Respite.
Well, that's very, very helpful, and we will probably take you up on that offer to work with you to formulate a question in your next survey. That would be fantastic, if possible. Last chance for any questions for Ken. Again, you can continue to type them in as we move forward, and if we don't get to them today, one did just come in from Gail Hunt. Given the small response of employers doing respite, how reliable are the subsequent breakouts about employers and respite?
That is an excellent question. One of the things we do with our data set is we make sure to always weight the data to the national standards. So in terms of what does sort of a random pulling of employers pull, it's representative of kind of the nation of Respite. When you want to say, is it representative of all people offering Respite, that's a slightly different question. So talking about it from a perspective of the country as a whole and what does Respite services look like, it's fairly accurate. From a perspective of how does it represent the entire pool of people that are offering Respite, it's probably a little less so because we didn't specifically go out and gather a representative sample of Respite offering companies. We gathered a representative sample of companies with 50 or more employees. So it's probably, as I said, it's a representative sample of the nation and what Respite looks like across the nation, but it's not necessarily representative of the entire pool of people that offer Respite, regardless of what's going on in the rest of the nation.
Okay, I hope that answers your question. If there were no more questions, let's move on to our next presenter, Gregory Johnson.
Thank you,
Greg.
So much. Thank you so much, Jill, and thank you, Ken. My team that's sitting here with me is dying to pour over your studies, and we look forward to it. And I love that Gail's on the line. She has been such a wonderful source, and if you folks don't know the National Alliance of Caregiving, it's one of the greatest gifts to family caregiving. Gail, good to have you on board. I'm Greg Johnson, and I am the creator and director of EmblemHealth's Care for the Family Caregiver initiative. And quite frankly, I have had the great blessing of spending the last nearly 15 years sitting in the middle of a healthcare corporation talking about what I like to refer to as golden rule living and looking at its many facets. And today we're going to focus a great deal more on the corporate. But I'm going to need to share a few things with you so that you might hear how we've approached it. this is not the definitive answer. And all of us here, EmblemHealth and the New York City Partnership for Family Caregiving Core, are extremely grateful to have a chance just to share what our experience has been. And wherever in the world I go, and I'm privileged to travel a great deal, I always do begin in the same way. And that is, if you remember nothing else I have to say today, know that I've come to say the two words that family caregivers rarely, if ever, hear. So listen up. Thank you. Thank you. Thank you. You're the backbone of the world's healthcare systems. You're dealing with what are often the silent patients. And that was actually my assignment nearly 15 years ago when the then chairman of the foundation that is the parent to EmblemHealth came to me. He said, we need to bring attention to the silent patients. And that has been our journey ever since. Now, I'm going to ask you, as we go through this and as we talk, as I do with every audience that I have the privilege of talking with, listen with your professional ears, yes, but also listen with your personal ears. You've heard part of my caregiving story. And without question, it's that personal story that has been the key for us here in New York in getting into the corporations with whom we are working and with the forming of the Leadership Council. It has always been that human story, and I'm going to talk a little bit about that later, but please do feel free to listen professionally with whatever organization, whatever company you might be with, whatever wonderful organization of service you might be doing, but also listen from the point of view of the caregiver, because when we do that, from our own experience, it certainly is true when I work with the clergy, when I work with the medical establishments, when we can be in touch with our own humanity, we end up serving one another. And quite frankly, that's what it's all about. We're brothers and sisters down here, and we need one another, despite how we may behave ourselves at times. As I always say with family caregiving, you can't pay it away, pray it away, or prescribe it away. You need all three, there's no question. But ultimately, you have to go through it. And it has been our hope that you'll grow through it. So let that just be as a beginning. Here's what we're going to talk about today, and I have to push another button. I'm not good at this technology stuff, and I have wonderful people to remind me of that. We're going to talk just briefly of an introduction. Now, you'll probably wonder, why on earth am I telling such famous people as each of you about family caregiving? Well, it's the words that we use to talk to corporations, the words we use about this issue, such as defining family and family caregiving. I'm going to talk to you briefly with 3 examples of 3 very diverse sorts of corporations, talk to you then about how the partnership was created, and share with you the Leadership Council. As an introduction to family caregiving, here we borrow from both the New York City Partnership of Family Caregiving Core, which was, from the New York City Family Caregiver Coalition, which was begun with the support of our wonderful Gail Gibson Hunt many, many years ago. We started with 15, and today there are over 325 persons in about 220 organizations. A family caregiver is a person who provides unpaid care for a relative and or loved ones. And here in New York, that second part certainly rings true. A family caregiver is someone, and this is the title of the book of the brilliant Carol Levine from United Hospital Fund, but it says it all. Someone who is always on call. And I always like to say it never happens between 9 and 5. Carol also has the phrase, a family caregiver is someone who shows up and stays to help. And boy, that last part, we all know, is the difficult part. So it helps to bring it quite clearly. From the very beginning, here at Emblem, I was asked what would be our mission statement. And I said, really, quite simply, it's keeping caregivers, caregivers. And frankly, as I've now spoken to thousands and thousands of people, nothing could be more true. Nobody wants to be sick. And quite frankly, a health insurance company doesn't want people to be sick. So by keeping caregivers caregivers, we're able to complete that wonderful healthcare cycle and not create more care recipients. Now, this is one of my favorites, and I love the fact that they made the slide go round, because sometimes that's sort of kind of, I don't know about you, but how family caregiving can feel. This is a slide that, simple as it is extremely helpful when I'm talking with corporations, because we get very mixed up on home health attendants and all sorts of people who play in the dramas. You know as well as I do that in a hospital, the emergency room has one group, the rest of the hospital has another group of people. They all have the same titles but do totally different things. So it's very important for us to level the playing field. And whenever we go in, I always choose to do this part and to share just enough of my personal story to watch the facades break, and then do the questions begin. I'll tell you more about that in a little bit. But obviously first, if we were to be candid, the first part of the healthcare system is someone who needs to be ill, physically, emotionally, and spiritually. You'll hear me talk about the trios, the triangles, the trinities that are ours, and this certainly is one. People get sick in all of the areas. Then the professional caregiver, from the highest paid specialist to that paid home attendant. They are paid, however much, however little. That's not what we're talking of. But they are the professional caregiver, and this is where people become confused when they're talking about caregivers, family caregivers, professional caregivers. So it's important about the words. The third, and my favorite leg, I've certainly devoted the last 15 years to it, along with a lot of you, family caregivers. And we talk about both families of origin and families of choice. Now we're going to look at the two words because those are the two most important words. We all have a birth family or we wouldn't be having this conversation. But we also have a lot of families of choice. Now the word families of choice, as many of you may well know, came out of the AIDS world. It was at that time that many of us were standing at hospital beds, holding the hand of somebody who had just died and waiting for the person next to leave this earth. It was at that time that vast family members were coming into New York and other big metropolitan areas, and in one instant, literally, learning two pieces of information that they were quite incapable of dealing with. One, that their child was gay, and secondly, imminently dying. And many of them fled. And so it was left to neighbors, to 12-step groups, to faith communities, to come and to be with these folks, and the response was incredible. It was powerful. It was the best of humanity in the worst of times. But of course, you know the medical system and the sociology system. They've got to have a name for who are these people. And that's where the term families of choice came in. But one doesn't have to be gay to be part of a family of choice. It can be a faith community. It can be a senior center. We, for these 2 hours, are a family of choice because we've chosen to come together to address this issue. And so I have spent a great deal of time, as has the New York City Family Caregiver Coalition, looking and naming all the families of choice because it's important. And in fact, I did a family caregiving committee in my apartment house because I practice everything I try out. Sometimes I succeed, sometimes I fail wonderfully. But I learn. And in my apartment house, it was very interesting. I live in a 20-story apartment house in the middle of Chelsea. I've lived there for nearly 50 years. And I came up with the idea of let's try a family caregiving committee in the apartment. And so I went to the board, and we got about 30% signing up for it. And no, that wasn't what we were after. Well, I am a man who prays. So I began praying on this and saying, what am I missing? I know there's something. And one day I had the most wonderful answer. The elevator stopped. The doors opened, and there was a gentleman, a dog walker here in New York. We have all sorts of interesting occupations. A dog walker who had 6 dogs, so it was he, 6 dogs, and me. And I thought, I know what's missing on the form. We added pets. And today we have 87% of a family of choice. So there are lots of them. And why am I saying this to you? Look around. It's already there. The issues are there, as are the solutions. And then with caregiving, it's been very important, and certainly in talking to the corporations. Now, earlier, Ken, and it was a wonderful statement, you talked about someone being a sandwich generation. I recently gave a talk where a 94-year-old woman told me that there were 7 generations in her living family present. And I said, well, I think we've got to call that the club sandwich, probably the ultimate club sandwich. But it was fabulous. And it's important for employers to know that there is a whole diverse nature in family caregiving that are affecting these wonderful human beings who are their employees. Yes, they're their employees for 8, 10, 15 hours a day, yes. But they work with you and me 24/7. And it is seniors, people like me, being cared for. It's seniors caring for seniors. It's seniors caring for grandkids. It's children. Gail's study of a number of years ago, the National Alliance of Caregiving, terrific. Look at it. Chronic conditions, disease-specific, end of life in the middle of life, long-distance caregiving. That certainly could never have been more true when my son was dying in Bali, himself a devout Hindu. So we had cross-cultural and probably the longest long-distance you can do, though we kept flying back and forth. Also, we have done a lot of work with veterans and the veteran caregivers. All of these resonate with corporations. Doesn't frighten them because it's honest and it's real. And quite interestingly, on next Saturday, I'm going to be at Fordham University with the chairman of their sociology department, where they will again be showing, and if you've not seen it, you must, the Angola Project, which is the redemptive power of family caregiving. Murderers caring for murderers within the prison system. That one blew me away at a summit that we did not long ago. So family and caregiving, it has a lot of faces, and we need to name it and know its many faces. Now, I spoke about trilogies, and there seem to be so many of them that do come up. It is body, mind, and spirit, there's no question. When I first began here at Emblem, bringing attention, as I'd been asked, to the silent patients, I immediately asked them and was pleased when they said, by all means, go do it. Do you believe, I asked, in the bringing together of the best of government, nonprofit, and for-profit, or the business community? And that has been the exact way in which we have moved forward. It is unity and diversity that is responsible, responsive, and replicable. Now, we have done a number of projects, and at the end of this slide presentation are all sorts of references that you can do and go to. But first of all, I want you to understand that, and this is what I was saying to you earlier, we found that in dealing with corporations, we only had to look at our own story, because EmblemHealth has been in business for over 75 years. And we came to understand that indeed family caregiving is the language of our clients. We are truly, and I'm pleased at the way in which they have evolved, that Emblem today is a leader as a health and wellness corporation who, yes, does sell insurance. But insurance is the way much of the caregiving is paid for and how the game is played. And that's said from somebody who also lives in Southeast Asia, where, you know, if something happens when I'm in Bali, I put $10,000 on the bank and buy 2 business class tickets and fly to Singapore. That's nothing against Indonesia. It's the reality. So insurance is a wonderful, wonderful thing. I wanted to give you, though, because I had done this with the Respite organization here in New York, wonderful, wonderful people. And one of the things when I spoke with them, I had urged them to remember we're all part of a corporation by and large. It doesn't take too much of a stretch, whether it's nonprofit, for-profit, whatever, we're part of it. So begin where we are. Look at our corporation. Who do you serve? What corporations do you presently serve? Another wonderful point of entree. And if you're a nonprofit, then who are your boards and your major donors? They're going to probably be. So in other words, we don't have to form a committee to find out where the corporations are. They're very much here and for us. Now, I'm going to also encourage you to consider this point. In looking to serve, we will be amazed that we can find caregiving in just about every situation. And I'm going to share 3 quick examples with you so that you'll see. But I also am going to share with you that when we founded the New York City Partnership, the Family Caregiver Coalition was founded first about 12 years ago. The partnership is something in the last 3.5 years that has been created to focus on the costs of family caregiving to corporations. But when we began this, I asked those whom I invited to join us to join me in honoring the spiritual law of giving. Now, I'm not giving a sermon, so don't worry. Not looking for funding, not looking for money, but looking for ways that we could give, that we could donate. And as we've given, we have been blessed, I can assure you. Now, if I can find the right place, there it is. The cost to the corporations varies, and again, a wonderful study from MetLife and National Alliance, 17 to 34 billion, depending on how the study was done. I want to show you 3 very quick examples. EmblemHealth, that's where I am. This was an insurance company that is now framed as a wonderful health and wellness company. I was given the mandate to bring attention to the employees, number 1, way back in 2001, for the employees, for the members, and for the community at large. Well, we're happy to say that one of the publications that Gail and I wrote for the 2005 White House Conference on Aging today is available in English. We've given away 200,000 copies of that. It's in Spanish, and it's now in Chinese, and as of last year, it's appearing on websites in Singapore and down in Australia. So it's exciting to see how this has gone from a concept of bringing attention to the silent patients to saying, who are these people? Who are the players? And how does it relate also to us? I'm going to come back to that in a minute. But I want to just share 2 quick other examples. Last year while I was at my home in Bali, friends from Australia came to introduce me to a gentleman by the name of Nev Highland, who has created a project in Southeast Asia, in Singapore and in Bali, as well as down in Australia, of taking refuse, recycling it, and building homes. Totally capitalistic functions, but with a foundation that's tied to it, which then builds roads, houses, schools, and so forth. And they said to me, what did I think? And I said, well, I know nothing about construction nor about green living and that sort of thing. But I said, I think you got 2/3 of this right. And this was my answer to them. I said, you're building houses because you're men of faith, and they are. You're creating homes. Eventually, I'd like to fill them with love and family caregiving. It's been an interesting year watching them grow. 2 weeks ago, they were again in Vanuatu, where the destruction family caregiving will be moving in. It's up, it's running, and it's exciting. Then, and this is the nonprofit world, on Monday of this week, last week I got a call from Imam Shamsi Ali, one of the leading imams here in America. He was hosting at the Nusantara Foundation here in New York a group of 8 foreign ministers from 8 Arab countries working with the State Department, coming to talk about building and helping them in confronting the ISIS threat. And so there were many of the leaders from the New York City Partnership of Faith. It was an incredibly candid and powerful conversation. And I had the privilege of being the one to end it. And it was at that point that I suggested that there are times, and this is a minister talking, that we need to put our theologies and traditions aside and look at the word love. and to begin with one example of love that transcends everything, and that's family caregiving. I can't begin to tell you the positive results, and I can't talk about some of it, but it was an incredible opportunity. Now, why am I saying this to you? Yes, it comes out of my life, and I can't live any other life than my own, and I'm very grateful for my life. I'm not doing it to name drop or to do any of that sort of thing. What I'm trying to do is say to you, you in your community, you in your world of influence, you in your faith communities have the opportunity to find exactly these sorts of situations, and from them will come the opportunities. Now, how have we done here? This I have put in, and you can study it later. This is the way in which we have dealt with family caregiving here within EmblemHealth. And I'm very happy to tell you this tiny little bit. When I came here 15 years ago, and I don't claim any credit for it, it's the geniuses that surround me, but it was very much a focus on cure, cure, cure. Today, I'm happy to say, as you can see from the screen, our tagline is far more realistic and attainable. It's what care feels like. And these are some of the diverse partners with whom we have worked, who themselves are corporations, who themselves have boards of directors, who also work in corporations. You see, it's that connecting. We don't have to always have every answer ourselves. Now, about 3.5 years ago, I was looking at what issue really I felt I could, before I go off into retirement, which is going to be more of an international life, might contribute. And I felt very strongly that this issue of getting into the corporations was extremely, extremely necessary. And I tried a couple of different routes. I tried the HR departments. That's not where I will devote my time. Many people are. It's wonderful. By all means, do the thing that works for you. But I have 3 experiences, and I'm going to briefly tell this to you because it again shows how life gives us the opportunities. So I've been praying very strongly on how do we create this, what could it be? Well, this is how I do research. I was, within about a 4-month period, asked or given the opportunity to attend to make 3 Shiva calls. Those are sympathy calls on a Jewish family who has lost a loved one. Now, it happened that each of the 3 people on whom I was visiting are owners of very, very, very major corporations. For me, they're personal friends, and I was going as a friend to express my condolences. But as we sat there talking, and as that usually does happen, and particularly when others also know that you're a clergy person, you realize you're talking family caregiving at its deepest and core value. And so I made a note to myself that, not certainly that evening, but at a time I was going to follow up with each of them, and I did. I took each of them to lunch, talked how they were doing, but I also asked, how could we have had the conversation that we had the night I came for the Shiva call? Because, you know, that's the work that I'm involved in. And there are, like you were, a family caregiver, your employees. Everyone at some point, and I always, of course, quote the famous quote from Rosalind Carter. And I was very interested that with each of the 3, I got the same answer, which was basically, well, give us a business case and don't sell us all those social services. We can't meet with all those people. So I, of course, quoted the wonderful National Alliance MetLife study, told them what the losses were. They said, okay, how would you suggest to fix it? And I said, well, I'm working on building a little corps, C-O-R-P-S, a little army for the corporations. And I knew from the topics I was getting, now mind you, we have all the specifics within the New York City Family Caregiver Coalition, tons of disease-specific and so forth, but I knew that was not the place to start. I knew I needed to begin with generalists. And so I went to Emblem, and once again, they generously said, yes, they would support this for a 3, and it's actually been now a 4-year process. I selected people who were generalists, people who were not selling anything, people who were not trying to get a product across, but people who were dealing with some of the hot-button issues that corporations often are confused about. We represented, obviously, the insurance world, the healthcare system with all of its changes, and of course that was all going on. I then went to, and he was still alive, Mike Nichols, the late director. He and Cynthia O'Neill founded Friends Indeed 22 years ago, and it's one of the finest crisis intervention centers in the world. They are true leaders, and all of these websites are linked at the end, so you don't have to take notes. So they were one, dealing with caregiving, with grief, with death and dying in an incredible way. Sheila Warnock has been, and I'm sure she's known to many of you as the author of Share the Care, and probably the most hands-on. No matter where in the world I go, I was in Australia last year, I can't tell you how many people came up and told me about their Share the Care group. Spiritual conditioning, and Marion Gambardella. Marion is a noted minister here with the Unity tradition, and Marion herself, a caregiver and the widow of a very noted opera tenor, has done a great deal in support groups. And this we find to be an important piece. Then SAGE, because I wanted to have the LGBT group. You see, we're taking all the possible areas that can be difficult for corporations to talk about. We talk about them because that is the world as it truly is. And here at Emblem, the doors are open to all people, and we are delighted to work with each and every person because it allows us to give a complete picture of family caregiving. The Aging in New York Fund, that is part of the Department of Aging, which in our area, in New York, the Area Agency on Aging, the AAA, is DFTA, the Department for the Aging. This is their arm which partners with corporations for public-private partnerships, and they have been an enormous partner to us. And I might add, that is one of those words that we in the healthcare world batter around, the AAAs. Remember, there are people out there, and many of them are corporate executives who are much closer to my age, for whom AAA is still the thing you call to get your tire fixed. So don't assume that people know, and I have seen, I will often be the one to make the brunt of the joke for me, but I will see by people's faces that they too didn't know. And it's so important because our area agencies on aging are incredibly important. The resources, the possibilities, the ideas, they're terrific, and the resources. And then finally, Intersections International, which is a part of the Collegiate Corporation that deals with veterans and civilian dialogues, and we have become increasingly involved. So with this little army, we decided to strike out and say, let's try and help the corporate world. And so we began doing everything I said to you. We looked at our boards, we looked at our customers, we looked at our clients. We thought we need to build some gravitas, and so the first things we did, I had been invited by Fordham University to teach a class on family caregiving, and I said, well, let me suggest that instead of you hiring me, let me pay for a one-day summit, and we did a summit there 2 years ago at Fordham University, bringing the entire core, and it was so exciting, called Name It and Know Its Many Faces. So the following year, last year, we did it at the New York Academy of Medicine here, and we had over 350 people who showed up. So we began bringing the medical, the social, and remember, that's very important, because in healthcare is, and I say this again and again, it's 20% medical, it's 80% social. Those are the big questions. How do we feed them? How do we move them? How do I get this? How do I get that? And thank heaven that is being addressed more and more. Because once you've got the diagnosis, it's pretty well there. You know what the path is going to be on that. So we need to be certain that we have it. So that was our second attempt. Then we decided, and I move along, we wanted, with the core, to address the economic impact, bring family caregiving issue and solutions to corporations, help corporations to understand how family caregiving-related issues affect the bottom line, and we know all of that, and find ways to help reduce loss due to the absenteeism and other related issues. Now, we began this past fall with the idea that we wanted to create a series. We now have the New York City Partnership agreed. Remember I talked to you about we wanted to come from the point of giving. Well, here are what I call my 5 points of giving. We are, as a team, ready to go in for a one-time lunch and learn. We are willing to do a lunch and learn series with all these wonderful people, and obviously, as you well appreciate, in New York City, there's no lack of keynote speakers. I mean, each of these people are fantastic and passionate and exciting and so willing. We are very happy to go in and create a family caregiving resource library for employees, and we're willing to go and help them with an online resource and toolkits, as well as doing online caregiver resource fairs. So that was one thing that we said, yes, we can give. But we also felt, and I'm blessed with the New York City Partnership to have some of the most talented writers and thinkers and people who have had, like all of us, we get into this business a little bit later on in life. So we've had the experience. I have people who have worked at the UN, who have been in the diplomatic corps, so they understand about writing, they understand about engaging. And we felt that we needed to create guidelines, suggested guidelines, very general, and that's what we have begun, because our ultimate goal is to have guidelines along with the 5 free offerings. Think the 10 Commandments. I know you're laughing at me, but that, I picture that in my mind. We've got the 5 free things. If we can have 5 to 7, I want those tablets for us in family caregiving. And so to implement that, after several meetings and writing, we decided that we would give a try to creating, and notice we always use with this team, to try to create. We had no idea that it might work. But we thought if we could form a corporate leadership council, basically from a C-suite sort of group of people. So each of us went to work. I'm so old, I went to my Rolodex, and we began calling. And it was our hope to perhaps get 4 or 5 corporate leaders. I'm delighted to tell you that at our launch of the Corporate Leadership Council, we had an audience of 77 people, of whom 36 came from the corporate world, most of which were C-suite. And it has been most exciting. The response has been incredible. You can see what our commitment was here. We made it very clear that it was about suggested guidelines, no formal agenda, no fundraising, no financial commitments, and no lobbying. We were neither endorsing nor opposing any causes. We were trying to bring the elephant in the room into conversation. And I have to go back there. So we invited people to come and to sign a pledge. On February 25th, we hosted the corporate leadership, and here, big sign, people signed it. We, the undersigned corporate representatives, hereby endorse the concept of and pledge, number 1, to serve as a charter member of the New York City Partnership for Family Caregiving Corporate Leadership Council, thereby recognize the importance of being a responsible family caregiver-friendly corporation. Secondly, to partner through a designated member from the corporate staff in the writing of the guidelines to be issued publicly by the council. And 3, to incorporate as many of these guidelines and New York City Partnership for Family Caregiving Core programs as possible within our corporate organization. I'm delighted to tell you that within 48 hours of this breakfast, already Time Inc. and McGraw-Hill Financial called and booked time. That has continued. I am very pleased. And actually, we've done the Time Inc. show. And by the way, you know I use theatrical terms, show. My background's theater and theology. So, hey, that comes through. And it has opened wonderful doors. Next Thursday, we're having the first meeting of the writers, and again, we have 32 people who are coming here to write with us. That is the way in which we have been going after opening doors. Now, I have put this here not to read to you because I just have this here because I want you to see the diversity of people with whom we've been working, and this is EmblemHealth throughout our entire scope from the very, very, very beginning back in 2001. The list goes on, and I invite you to add your names because we're honored to be talking with you today. I'm leaving with you this information, and I'm also leaving with you this, which is a series of 2 websites, the YouTube channel and the Corporate Caregiver website. But before I conclude, I just want to thank you for everything that you are doing. Family caregiving is golden rule living. It's Matthew 25, it's Tikkun Olam, it unites us. And so if you're in New York on October 7th, the Johns Hopkins University and EmblemHealth will be hosting the William Perper Symposium at the New York Academy of Medicine, and it's entitled Faith in Action, a celebration of family caregiving, unity in diversity. And so I want to conclude with something I wrote quite a while ago, and I mean it for each of you. It's entitled We Are, and I wrote it to conclude one of our New York City Family Caregiver Coalition galas. We are truly diverse and inclusive. We are women and men, black and white, and all shades in between. We are straight and gay. We are Christians, Jews, Muslims, Buddhists, agnostics, and I hope a few atheists. It keeps us all growing. We are from all over the world. We are New Yorkers, one and all, by birth or adoption. We are family caregivers. We are big business, government and nonprofits. We are researchers and center leaders. We are formal caregivers and family caregivers, and we are learning to talk to one another. We are finding a common language and moving the dialogue forward. We are about seniors caring for seniors. We are about seniors raising grandchildren, kinship. We are about children caregivers. We are about gays and lesbians facing end-of-life issues in the middle of life. We are about people with chronic conditions. We are family caregivers, and we care. We are rich, we are poor. But we are all extremely wealthy with love, caring, and compassion. We are channels for one another and for others. We are channels of goodness and love. We are not going through life, we are growing through life. We are not human beings trying to have a spiritual experience. We are spiritual beings having a human experience. And we are sharing the caring. And to each of you, we here say, thank you.
Thank you very much, Greg. That was Gregory. That was incredibly inspiring. And I'm hoping to open it up to questions now to our webinar participants. If you have any questions, please type them into the chat box for Gregory. While we're waiting for people to type in, I do have a question for you, Gregory. This is Jill.
Yeah.
These efforts that you've described through the Caregiving Corps and the Corporate Leadership Council, are these things that our grantees and state respite coalitions are free to try to replicate in their state level?
Absolutely. Anything that we have done with EmblemHealth, you don't need to be an EmblemHealth member. In fact, here in New York, we have some things called the EmblemHealth Neighborhood Care Centers, which are in various parts, brick and mortar buildings, not about sales. We have lots of support groups, lots of work, and I brought corporate leaders in to see what a corporation is doing in the world of caregiving. Show and tell still works. So, but yes, anything that we're doing, we would only urge you to do it, and we'll be delighted to talk with anybody. And as I've told you, I'm one of these funny people because I'm so old and I get crazy looking for it. I put my phone number on the website.
We appreciate that. I only ask, and I'm wondering if you have, I think your major message really was let's begin the dialogue before we start asking for specific services like Respite, that we start to begin the dialogue with our corporate partners and offer to give or provide information and support to their caregiving employees as a step through the door.
Well, Jill, it's like anyone in business, anyone in social services, certainly any of the clergy I've ever worked with. What do we say? Meet the person where they are. And that includes the CEO who may have tons of money and what have you. They still are as lost as you and I can be. And so it's meeting them where they are, not assuming that they know the terminology. Their world of caregiving may be a piece of it. And of course, that's where it's very helpful to know corporate leaders, and that was certainly true with the breakfast we did. There were a number of corporate leaders here with whom I have worked as Reverend Johnson, but I knew their story as a caregiver. They were different. Some were seniors, some were children, some were suicide, but they've all been through issues of family caregiving. And they are some of the best ambassadors in the world. And one of the things that constantly corporate leaders say to me is, I had no idea there were so many resources. Interestingly, this is an anecdote, but it's how I do most of my research. When we did Time Inc., now that's a major, major corporation here in New York and nationwide. We had 54 employees who came to the New York office. They're in many places, but they were in the New York office. And we had another, I think it was 28, who dialed in from across the country. We did a format in which I just very quickly leveled the playing field and, as I said, tell enough of my story to, as it were, break the facades and help people to know that it's safe and anything we're going to talk about will remain here. And at an hour and a half, we couldn't get them to leave. They have now, and it was interesting, when Time Inc. called me, they said they have affinity groups. In other words, within the corporation, they have groups of people who have regular meetings together. And there are four main affinity groups: the African American, the Latino, the LGBT, and the Chinese. And when she offered this program, all four of them became co-sponsors.
Thank you. I think that's very helpful. And not having seen any additional questions or comments, I want to thank both of our presenters again for an extremely informative and very stimulating webinar. I certainly learned a lot, and I think as our grantees and state respite coalitions move ahead with engaging employers in lifespan respite, that they consider the value of the work that you've done to first begin to educate the community. That's our first line of entry, and that it is a process that could take some time, and to be patient with that. But again, I want to thank you both for fantastic presentations, and thank all of our participants for joining us today. I hope that you found the webinar to be useful. I want to remind you that at the end of the webinar, when you close out, you will see a link to a survey to give us your feedback, and I really would urge you to please take a moment to respond. Your feedback is very important to help us improve those webinars. I'll give one more chance to our presenters or to the audience for any last comments or questions. Well, then thank you all very, very much. Thank you for joining us, and watch your email inboxes for links to the archived webinar in the next few days. Thank you, speakers. Thank you so much.
Thank you.
Thank you.